Endometriosis. This is a pretty common fertility issue that a lot of women experience, but sadly it often goes undiagnosed. And women that have symptoms for endometriosis, which I will quickly get into, are often told, it's fine, you just have heavier menstrual periods than other people, just like take some Motrin, you'll be fine. And then they're not fine, and they're not fine, and they're not fine, and then they have trouble becoming pregnant. Okay, so what is it? Endometriosis is a often very uncomfortable condition that involves tissue that typically just lines the inside of the uterus, growing outside of the uterus. And this tissue can impair the function of the ovaries and the fallopian tubes, and they can sometimes cause cysts to form. And so because they can impact the ovaries, they can impact ovulation, you know, the egg's ability to release and be fertilized by sperm. And then those fallopian tubes need to be unobstructed for that fertilized egg to be able to reach the uterus. So yeah, endometriosis can cause a lot of fertility issues and a lot of pain. And it's important for women to understand the symptoms and to seek treatment if you have any of these symptoms. And luckily with the right support, most of the time women can get proper treatment for the discomfort, but also proper treatment to be able to become pregnant. And if you go to your just standard OBGYN and they just kind of brush you off, but you feel like, no, something else, something more than just me having a period every month is going on. There's something happening inside me that is really exceptionally uncomfortable. I would recommend seeing a fertility specialist. And I totally get that this can be a really big investment, but typically fertility specialists are more qualified to, you know, really dive deep into what's going on with you and to help you get quality treatment. Plenty of OBs are as well, but some aren't. So again, if you get brushed off by your OB, I would make the next stop a fertility specialist. So common symptoms of endometriosis include incredibly strong menstrual cramps. If you're somebody that's like, I often have to call out of work or school when I have my period because my cramps are so unbelievably painful, you might have endometriosis. If you have a really heavy menstrual flow, lower back aches, especially during your period, painful urination or bowel movements, discomfort during intercourse, a lot of abdominal bloating, constipation, and nausea. You don't necessarily have to have all of those symptoms to have endometriosis, but if you have a combination of some of those symptoms, again, seek that treatment. And when a woman suspects that she does have endometriosis, the first two things that happen are typically an ultrasound and a pelvic exam. And in some cases, the care provider might also recommend an MRI or something called a laparoscopy, which I'll talk more about in a minute, to help to, again, look inside the woman's reproductive system and see what's going on. And if a woman is not trying to become pregnant, the symptoms of endometriosis can often be managed with birth control pills or different forms of birth control and certain dietary shifts. But if a woman is wanting to have a baby and she is struggling to become pregnant on her own, just through the classic method of having sex, there are fertility treatments that can be really helpful for women with endometriosis. So one of them is laparoscopy, and this is a minimally invasive surgery that allows the doctor to go in and remove endometrial implants, scar tissue that might be interfering with your ovulation, with your fallopian tubes, and the implantation of the embryo in the uterus. And some women need this procedure several times throughout their reproductive years to essentially keep everything clear so the body can become pregnant. So again, you would have the laparoscopy and the care provider would let you know when you're good to start trying. You would actively try to get pregnant just through tracking ovulation, having sex about 5 or so days every other day before you ovulate, and then they'll let you know, how often they want you to come in for an evaluation and how often they think you might need to have laparoscopy. And laparoscopy, again, is also a way for them to look and see what's going on in your reproductive system. Okay, an IUI, also called an intrauterine insemination. So this treatment involves the woman monitoring her ovulation, typically with an ovulation prediction kit, and then you would go into the fertility clinic on the day that ovulation is likely to occur, and the fertility doctor will use a catheter to insert sperm either from the woman's partner or a sperm donor into her uterus. And the idea is the sperm will make their way up to the egg, fertilize it, and that fertilized egg will move down the fallopian tube and implant in the uterus. And the most intensive fertility treatment is IVF, or in vitro fertilization, which is the fertility treatment that most people are familiar with. It's one of the most talked about fertility treatments, somewhat because it can be so successful. And so, if treatments like laparoscopy, IUI do not result in a healthy pregnancy after a certain period of time, a fertility specialist might recommend moving on to IVF. And IVF essentially consists of the woman taking ovulation induction medications that are given through injection, but not like giant needles. They're fairly short needles, very, very, very thin, that the woman would inject in the fat around her belly button, like in the lower abdomen. And it really just feels, I've taken them before, it just feels like a pinch. It really, and I hate needles. I'm terrified of needles, and these wasn't an issue to take these for me. It just feels like a little pinch. And you can also numb the area. I'm actually going to do another video on how to make that process more comfortable if you do end up needing to take injectable fertility medications. So you're taking these medications, and during this time you would regularly go into the fertility clinic, usually like every other day or so, for a blood test and an ultrasound, and so they can track how your eggs are growing. So these ovulation induction medications cause multiple egg follicles to grow and mature instead of just one, which is what typically happens during a normal menstrual cycle. Only one egg matures, but in this case, multiple eggs mature. And so the doctor tracks them, and when enough of them are the ideal size, the doctor has you take something called a trigger shot, and this prepares the body to release these eggs, and then about 36 hours later, you go in for minimally invasive surgery. You are under general anesthesia typically. The doctor goes in with the needle and takes and essentially pulls out all of the eggs. It usually just takes 15-20 minutes, pretty short procedure. And then they send those eggs to the lab, and an embryologist then fertilizes those eggs with sperm from the woman's partner or sperm donor. And then a lot of times, or most people now, use something called PGT, or pre-implantation genetic testing, to then test the eggs to see which ones are actually healthy. And then the doctor would transfer one healthy egg back into your uterus during a very short procedure, and hopefully that egg will develop into a healthy pregnancy. So those are, some of the symptoms, some of the common fertility treatments for endometriosis. If you suspect you have this fertility condition, I highly recommend you at least first check in with your OB and then eventually potentially check in with a fertility specialist. But please seek more information and treatment for this. And let me know if you have any questions or comments in the comments below.